Dr. Tom Roselle live right now, 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live in studio on a very lovely Sunday afternoon. Got to get outside and relax and take a walk. That's after you listen to the program. We're waiting for your phone calls at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. We've got a subject, we have a topic, and I have a guest to discuss that for you. Dr. Leonard Poe, who you've heard many times before, and we're going to talk about diabetes, but also blood sugar levels and what happens, and from hypoglycemia or low blood sugar, how it reacts, and ultimately many of you, unfortunately, almost 8% of the United States population are type 2 diabetic, and it's rising, unfortunately, because of lifestyle, because of the things that we do. This truly is one of those things that you can put your finger on and see the effect of life outcome, meaning all those things that you do that you shouldn't be doing, all the things that you should be doing that you don't do, for example. We're going to talk about that, and this Wednesday evening, Dr. Leonard Poe will be your host. And hopefully you will be our guest at the Roselle Center of Healing, and he will speak to you on diabetic problems, but more importantly, how you can turn them around. Dr. Poe, welcome.
Thank you.
Listen, this is a topic that we deal with in our practice because it truly is a structural, chemical, emotional problem. It's something that most people don't realize that they have had a very direct finger in the pot, if you will, causing it ultimately to show up, and they say, oh my God, I'm diabetic, or I'm borderline diabetic. Yeah,
unfortunately it can be found very, very early on too. It's not something that you have to wait until you get diagnosed as being type 2 diabetic. You can get to it much, much earlier.
You know, the problem that I see is, through applied kinesiological muscle testing and neurological testing and the functional medicine that we do in our practice, what we end up seeing is we can predict, if you will, that somebody is going into a diabetic situation, or they're going into a hypoglycemic, hyperglycemic reactive type of pattern, up and down. And they just came back from their doc. And their doc says, you're fine, you're perfectly okay. But they have all the soft earmarks of having a problem. Why?
Why do they send them home, or why do they have the earmarks?
No, why do they have the earmarks? When the blood work comes out and it says it's perfectly fine, there's nothing wrong with the blood. There's not, but all the patients have the issue.
One of my biggest pet peeves with blood work in general is a lot of people like to go off those laboratory ranges, and we know that the laboratory ranges they're these huge statistical bell curve ranges. They have nothing to do with actual physiological function in the body. They're terrible ranges. So you look at some of these ranges that are there, and they say, well, they're within range. Well, they're not within functional range, and that's something completely different, and you and I both know this. The other problem is that you've got to understand some of the limitations that you get from blood work. And, you and I were talking about this the other day. You can see a blood glucose level that looks fantastic in blood work, 85, 86, somewhere, mid to high 80s. And you take some other measures, you look at some other marks, and you can figure out things like insulin resistance and, what beta cell production is in the pancreas for insulin. And you find out that you're 50% insulin sensitive or insulin resistant.
The unfortunate part is that most physicians look at fasting blood sugar as the sole determining factor whether or not somebody has a potential diabetic situation, or that in fact that they're in diabetes, or that they're hypoglycemic. And the truth of it is that there's many more things, as you suggested, that would say you really have a problem here, even though that your blood sugar is not showing it.
It's a good place to start, and you want to check that. But there are a lot of other pieces. If you really want to look at pancreatic physiology and make sure that you're handling blood sugar the way you're supposed to, there's lots of other things you have to look at besides that. That's not the one be-all for measuring that.
Well, here's the deal. Patient comes in, and they're complaining of shakiness. They're complaining of body ache and pain. They don't feel really good. They don't have the energy that they should have. They've noticed that they're swelling. They're noticing that they can't put on muscle tissue, that they're wasting actually. But they go to the doc, and doc can't find anything because everything seems to be within laboratory norms.
Everything looks normal.
Yeah, everything looks normal. The truth of it is, it's not normal. So let's take that patient.
Physiology is in motion all the time, and blood work's great, but it's a one snap view of something. You have to look at how it's applied throughout the entire day.
So, in other words, somebody can come in the morning with an 85 blood sugar level, and in the afternoon they could be in the same type of situation, not having eaten, that blood sugar go right through the ceiling.
Yeah. Patients are shocked. And, we do a lot of the testing with for the adrenal glands. And we've talked about that a lot on the radio before. And one of the tests that we always do is the Asi Test. And on that test, we get a lot of different data of that. But one of the things that we measure is there's an insulin challenge there. Not blood glucose, but insulin. Is insulin responding to blood sugar the way it's supposed to? And patients are always shocked when they see that their insulin's not responding.
Well, we know that there's two types of type 2 diabetes. That's an interesting play on words, but the truth of it is that you actually have two different parameters generally. One is that you have the pancreas not producing enough insulin.
Right.
So you can't transport it. What happens over a period of years, it gets tired. Second is that there's this thing that we all talk about now called insulin resistance. Mm-hmm. And it's that the insulin can't drag the blood sugar into the tissue. So it's not working the way it's supposed to.
Right. So, I would argue with you there that really one is that they're both really the same, and that one's a little bit later on than the other, because you're going to have that insulin resistance first.
So this is a professional argument now.
This is a professional argument.
Okay.
Do you want to talk about 1.5?
Go ahead.
Because we focus a lot on, and for some reason we can't get out of this lock of it's got to be something between it's either a child or it's an adult. But we've got the typical type 2 diabetes, which we know is where your pancreas is no longer making insulin and you're an adult. There's another one that we talk about, which is 1.5, which is really the same thing as juvenile diabetes, but it's just late onset autoimmune. And you'd be surprised how many patients I find that with today as well, where the pancreas is being attacked, and that's why it's no longer making insulin correctly.
People really don't understand what happens. We're seeing this across the board. Now, we can extend this conversation if we wanted to, because the parameters are basically the same.
That's why we're doing a lecture.
I know. And we can extend it into how it affects other situations in the body. It can affect thyroid hormone. It can affect the androgens, the estrogens, progesterones, and so it affects everything.
It's the flip
same
side
underlying cause
of anemia. If you don't have sugar in the cells for metabolism, you don't have any cellular metabolism happening.
This Wednesday evening, Dr. Leonard Poe will be your host and hopefully give you the information that you're really looking for as it comes to blood sugar handling problems and diabetes at the Roselle Center for Healing. That's this Wednesday, the 7th of March, and we encourage you to please be there. If you'd like to attend, all you need to do is give our office a call. It's 703-698-7117. That's 703-698-7117. And those of you who attended the lectures recently know that it's a sold-out house. These are our gift to you. This is a way that we exchange with the community, that we try to give you as much information as we possibly can. We'd love to have you, but the only thing that we do require is a reservation, and that we confirm the reservation and not just walking into the office, because there's no place to sit. Once we get to about 50 people, that's it. And we did the presentation on adrenal stress twice in 2 full houses. So give our office a call. It's 703-698-7117. Tell my staff that you'd like to be there. We already have people on the list waiting for this Wednesday, so please be our guest. This Wednesday, the 7th of the month. Let's continue the process here a little bit, and let's get into why we see so many variances, if you will, in what the traditional allopathic community considers a diabetic presentation.
Because you need a drug to treat it.
That's true. That's true. Are you trying to say that there's
you really want to get into
financial consideration?
Let's wait.
I didn't say that.
Let's watch it.
I didn't say that.
Let's keep our eye on it, and then we'll give you a drug for it. Now, diabetes doesn't happen overnight. It is a long, drawn-out process, and it's something that can start as young as 20s or 30s. Teenage years even. You can start getting that insulin resistance starting to build, because there's lots of different factors that go into that. One of the big things that we always talk about, and you talked about it the last 2 weeks, is stress. Stress drives up insulin, and it creates this nasty snowball of cortisol and insulin production, and driving up blood sugars, and that's one of those pieces that starts to push you towards that.
And we do that on a day-to-day basis. Stress is just not emotional. Stress is living with pain all the time.
Yeah.
It never goes away. You've never done anything to correct it. Stress is instead of, eating the things that you need to eat, going and get a salad with a piece of protein on it for lunch, or getting something that has protein in it for breakfast, and eating periodically throughout the day, you're grabbing a ho-ho, or you're grabbing a soda, or you're grabbing something else to try to maintain that blood sugar level, because that's really what you're craving. And you crash. Ultimately, it goes down the tubes. But the inflammatory level, the acid, goes high. So, as we said, and as you said a moment ago, cortisol goes up, and then we have a demand for blood sugar. Then blood sugar goes up, then we have demand to produce insulin. Whether or not there's any food in the body, the stress will do that, and then it causes depletion across the board.
Yeah, real stress, imagined stress, good stress, bad stress, it's all the same physiologically. And it's not a process that we can directly, through mental control, get a handle on.
So when a patient comes in and, they're complaining about pain or I don't feel good, and we see a lot of patients that just come in and said, I'm tired, I don't feel good, I
should feel better.
And when do you start thinking that there may be a blood sugar handling problem?
As soon as they
Always?
walk in.
Immediately?
Because it's true for a lot of people. And, there's two questions I like to ask patients, especially when I'm suspecting something like this. How do you feel after you eat? And
do you go to sleep?
It's not a trick question. It's, the right answer is full, and that's about it. You shouldn't feel more energetic. You shouldn't feel more tired. You should feel full. And if you're not feeling full, if you're having those feelings in either direction, then you're having some tendencies towards some blood sugar handling problems.
Yeah, if you sit there, if you have something to eat, regardless of what it is, and you want to go into coma, you want to sit there and go to sleep, you can't keep your eyes open, you definitely have a blood sugar handling problem. Yeah. Or you could also have an allergic reaction to whatever it was that you eat, but the truth of it is one perpetuates the sameness of the other.
And the reality of it is, and you see this with your patients, I see it with my patients, I see it with you see it with me. I mean, we're busy, and we get going throughout the day.
Gee, you really think so?
And we stay busy. It's so important for us to take those. It's not. We tend to think of it as so much as being it's what you eat. It's what you eat, but it's also when you eat, how often you eat. That's a big piece of keeping those blood sugars stable.
It's keeping it level.
It's
across
keeping
the board.
It level.
Mm-hmm.
You don't want these highs and lows. You want a very nice even keel level. Those steady blood sugar flow throughout the body the whole day. You don't want them up and down, up and down, up and down.
And the thing with it is we talked about, it causes an inflammatory reaction, and then it perpetuates the end production of some nasty things, not only diabetes, but it starts deteriorating the eyes because of the inflammatory response and the acidity. It causes cardiovascular disease and hardening the arteries. It's deadly, and it can be very simply solved by maintaining a good dietary balance with little bits of food, particularly proteins, getting rid of the starchy carbohydrates on a day-to-day basis.
Yeah, it's a matter of figuring out, putting into lifestyle, how do I get the good protein, the good fats, a little bit of carbs throughout the day, where I'm not waiting 5, 6, 7 hours in between meals. You can't do that.
Once you go into the glycemic dump, and your body feels that sleepiness and so forth, you've got a problem, and you've perpetuated over a period of time. There's no stability in your body, ultimately, because of the increasing cortisol spike, which we've talked about for the last few weeks, is going to start eating you up. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio, 888-630-9625. That's 888-630-WMAL. Love to take your phone calls on any subject that you have in mind. We're talking about diabetes and blood sugar handling. My guest in studio, Dr. Leonard Poe, who will be your host this Wednesday, the 7th of March at the Roselle Center for Healing. He's going to be talking about blood sugar handling problems, type 2 diabetes, what you can really do to turn it around and correct it. If you'd like to attend that class, please give our office a call at 703-698-7117. That's 703-698-7117. As you know, most of these classes are full, and we do require a reservation, and then we will confirm with you to make sure that you will attend. 888-630-WMAL. That's how you reach us here. And by the way, if you'd like to re-listen to any of the programs on Dr. Tom Roselle Live, go to RoselleRadio.com. That's RoselleRadio.com. And you're going to find all of our programs archived, but more importantly, we're now doing some video presentations of the program and some other things over time that I think that you're going to enjoy, so you'll be able to learn and really apply the information that we want to give you. So go to RoselleRadio.com. You can call us here at 888-630-9625. Dr. Poe, we're talking about diabetes. Diabetes and blood sugar handling.
Everything and in between.
Everything in between. And we know that when blood sugars go crazy and they get out of hand, we risk a lot of things. We risk things like cardiovascular disease, and we risk destruction of tissue, and we aren't able to build and repair our bodies the way that we're supposed to. And
it gets us into that catabolic state where our tissues are just breaking down, and they're not building back the way they should, unfortunately.
You know, interesting statement from the Department of Medicine at Case Western Reserve University by a guy by the name of Saul Gunath, medical physician, and Richard Kahn, Ph.D. He's from the American Diabetic Association. And they said that glucose, a molecule once thought to be a critical blessing essential to life, is now thought to cast a dark shadow on life, even in supposedly normal range. And that's what we're talking about, even in a normal range.
Yeah.
And, you know, let's talk about that a little bit more.
The normal range?
Yeah. What is normal? What really is functionally normal? How can someone be sure that they're not diabetic?
Well, it depends how you want to measure it too. Let's talk about true type 2 diabetes. Okay, where there's no other underlying pathology present, and it's just the fact that you have worn out your pancreas to the place where it's not producing the way it should anymore. Is there a way to get that back? Yeah, absolutely there is. Okay. When we're trying to measure and figure out, well, what's normal, where should it be, there's lots of different measurements you got to take to really look at that. From a very subjective point of view, well, how do you feel after you eat? How do you feel before you eat? Are you eating regularly? What's your energy like? All those different things factor into it. But when we're really trying to get in and measure it and look, okay, what's normal, what's not normal, you've got to look at glucose, but you've also got to look at insulin in some regards. But insulin has a very short half-life. It doesn't stay around in the body very long. So there's some other markers that you really want to look at as well to get a good idea of what insulin production looks like. C-peptide is one of those markers that we talk about, and you want to measure that along with it. I always, for all my patients, it's just part of the blood panel they do with me, I always measure a marker called C-peptide. And that way I can tell and I can start to measure out what does your insulin resistance look like.
And it's one of those things that most physicians do not utilize in the evaluation of someone who's potentially diabetic.
What's very interesting is when with type 2 diabetes, when they're not producing insulin anymore, C-peptide is not something that is put in with insulin medication. So it's something that you can always go back and if you're trying to correct this and right this and get your insulin production back, which you can, C-peptide is one of those best markers to use because you'll start to see that C-peptide is coming back. And then that not all the insulin that you're measuring is coming from medication alone, that you are starting to reproduce it some. And then you can start to measure it that way as well so you can gauge the recovery cycle.
Let's go to the phones. Tom, thank you for calling. How can I help you, sir?
Hi, this is Tom. Can you hear me?
Yes, sir. We sure can.
Great. I had a Whipple procedure done several years ago, and I've had my
pancreatic cancer.
Yes.
Okay.
So, I'm fine now. The issue is that I get certain fatigue in my D, my B, my potassium are low, and I'm trying to understand ways to kind of manage that. And I do get fatigued in the afternoon. Are there suggestions in terms of like what I should eat? I do eat protein. I try not to eat too much carbs, but I do like bread. That's one of the problems.
Yeah, that's going to dump you even more. When anything, you've had, when they did the procedure, did they take out any of the stomach with it, or did they just work on the head of the pancreas?
Yeah, they took part of the pancreas, the duodenum, stomach, small intestine,
well, the biggest problem, Tom, I only got about 45 seconds. I'm going to try to encapsulate it for you. The problem is when they take part of the duodenum, you're not going to absorb a lot of the B complex. That's where they go. Zinc as well. And zinc is necessary for the production of insulin from the pancreas. So you're going to have to increase the minerals, particularly in liquid form, and increase your protein levels and digestive enzymes. So you're going to have to take a digestive enzyme supplement all the time, and as well as pancreatic enzymes. We call them proteolytic enzymes. You're going to have to make sure that you're able to handle those things. But the carbohydrates are going to tank you. They're going to knock you right on your tail. And so you have to eliminate those, and make sure you're getting a lot of very usable vegetables in your diet.
With the vitamin D as well, since you no longer have the gallbladder, you're not going to have those bile salts to help emulsify the fat and get it absorbed as well. So that's also going to be a problem for any kind of fat-soluble vitamins. You're gonna have to find better ways to get those in, and probably a supplement as well to help with gallbladder, even though to help with fat digestion, I should say. To supplement for what the gallbladder's not doing.
I got to tell you guys, this is useful because when you have this, they don't talk about it.
No, they don't. They just take it out and say good luck. Basically.
Yeah.
Listen.
Have some bacon for breakfast.
I've gone to dietary people. I have not had even this moment of discussion over the last several years.
Tom, do this. Give me a call or either give me a call, either Dr. Poe or I, or write me a note at rosellecare.com. And there's a great doctor in Baltimore that can be of use to you. So if you would do that, I'll get that information to you. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio. 888-630-9625. 888-630-WMAL. Love to talk to you on any subject you have in mind. We're always here every Sunday at 12 noon, broadcasting to you on 105.9 FM and AM 630 WMAL. My guest in studio, Dr. Leonard Poe, one of my best colleagues, and I was going to say, no, I'll leave that piece out, right? I got to be nice, It's family too. It's family time too. It's like
you're scared
yes,
because I have more of a quick wit than you.
Excuse me. Okay, we won't match swords here on the program. Later on, however, I've already been admonished, because I'm so ADD, as he puts it, that we have to share rooms in the office, and I'm putting things all over the place, and my brain doesn't work as OCD as yours. So, is that called both ends of the spectrum?
I'll admit maybe a little bit. Maybe a little bit. 888-630-9625. Dr. Leonard Poe will be your host and presenter this Wednesday evening, the 7th of March at 7:30 p.m. at the Roselle Center for Healing. He's going to be talking about diabetes and blood sugar handling problems. If you're a type 2 diabetic or you're on the cuff, you have blood sugar, you're hypoglycemic, trust me, it's all the same model, and there's ways of putting the fire out permanently if you're willing to take the steps, without drugs, without surgery, without any of the nonsense that you've been playing with up until now. And there's I'm going to cut in on you here. There's lots of ways too to keep the fire from ever starting, and that's the other thing. This is not just going to be a lecture on just diabetes. What do you do once you get there? But it's going to be the whole spectrum of dysglycemia, and how do you avoid getting there? And are you there now? Because, like I said, I've had lots of patients. I know you have that are shocked to find out that my pancreas isn't working right. I'm not producing insulin the way I'm supposed to. I have blood sugar handling problems, and utterly unaware. 703-698-7117, 703-698-7117. That's how you register for the class. Talking about that piece, blood sugar is normal at one part of the day. All of a sudden, the next part of the day, blood sugar is either crashed down around their toenails or it's up around the ceiling. Yeah.
Why?
Well, okay. That's kind of an unfair question. There's lots of reasons why.
I'm getting even. Go ahead.
Usually, one of the biggest reasons is, fasting blood sugar is great, but that's not how it's supposed to stay all day. You're not supposed to fast, throughout your entire life. Most people, they don't get up and they don't have breakfast. I talked about this when I did the program with my wife on New Year's. The biggest meal of your day should really be breakfast. It's to break the fast. And most people don't even start out with, the best breakfast maybe they get is a cup of coffee and maybe a donut or something like that.
Yeah, a candy bar when they get to the office.
It's, some little, a bagel or something. You need to have a good breakfast. You have to have some protein in there. You have to have some good fat in there. That's the piece that really starts you off and starts that blood sugar metabolism off to the best start. But we skip that, and then we wait till, maybe we have like another cup of coffee at 11 and then maybe lunch at around 1 or something.
It's crazy. I mean, patients come in and, I start seeing patients very early in the morning. Obviously, I'm in the office by 5:45. I'm up by about 20 minutes to 5. But I eat. I take the time. I get a protein shake. I grab a couple hard-boiled eggs and a handful of organic grape tomatoes, and I eat them on the way out the door to the office. And then I'm picking all morning long. I'm grabbing some nuts. I'm grabbing, whatever's available to me.
If you have to drive in Northern Virginia, you should have a good breakfast. Because as soon as you get in the car, guess what? Your cortisol levels are going up, your stress levels going up, and it's wrecking your blood sugar.
And what people don't understand about blood sugar regulation is that if you don't have it, that cortisol is going to demand that you get it, and it's going to start eating muscle tissue up to convert it into glucose. That's why when your blood sugars are out of balance and your stress levels are ridiculous, that you cannot build muscle mass, you can't maintain it, and you degrade that much faster.
Now, you've got to step back, and you've got to get that blood sugar under. You've got to get that glycemic control back. Until you do that, you're going to continue to deteriorate.
You know, you talked about in the last half of the program the adrenal testing that we do on so many patients, and we do salivary testing. And one of the things that we look for is the level of insulin, both in a fasting state and then after a carbohydrate stimulation, to force the blood sugars high into the blood and then demand that the pancreas produce insulin. Yeah. And what we see is that in so many situations that the blood sugars are just sitting there because the pancreas can't put out the insulin it should, because now we're going into a state of pancreatic failure. The initial step is fatigue, and then resistance, and then shutdown, and that's how it works, and we ignore that. We don't understand it. And what bothers me most, and what really upsets me, is that when you go into a traditional allopathic physician, now, having said that, there are many other physicians, allopathic, osteopathic, that understand functional medicine. They get this. They get what we're talking about. But there's so many of you that go in and they look at your basic fasting insulin or blood sugar, and they say, you're fine.
And they're looking at the range of, 69 to 100.
Right.
It's ridiculous.
Or your A1C hemoglobin is that borderline. We know today that A1C has to be at under 5.7. And these physicians still say that anything above, 5.9, 6, 6.1, 6.2 is still okay. You're still marginal. But that's not the rest of the story, as you were talking about earlier.
And that's the thing. And it's like I said, you got to realize too that blood test is a snapshot. Physiology is body function in motion, and that's why I like the insulin challenge, because it tells us, well, what is it actually doing? Not just what does it look like fasting, but what's the pancreas actually doing? Because that's what you're really trying to measure when you're looking at glucose. Is you're looking at, well, is pancreatic function working the way it's supposed to? Is that part of the endocrine system doing what it's supposed to do? And that's what it tells us with the insulin challenge.
And remember, we said that in a type 2 diabetic situation, there are two different formats that are accepted medically right now. One is the fact that the body is not producing, the pancreas is not producing enough insulin. And it's not producing enough insulin either because it's tired, it's fatigued because it's been stimulated so much, or it doesn't have the nutrient bases available to it, B complex and zinc and so forth. As our caller mentioned the other day, he went through a Whipple procedure for pancreatic cancer, and nobody told him that when they took part of the proximal portion of the small intestine, the duodenum, that he's not going to absorb certain nutrients and vitamins, including zinc and some of the B complex and the like.
If you had parts of your digestive system removed, you need to come in, you need to see a nutritionist and have some direction on, how do you eat? What are your dietary values now? What do you need to be careful of? What do you need to put in? How do you get your vitamins? Because it's changed. The anatomy has changed, and the ability to absorb those things has changed. It's been altered.
And one of the things that we've talked about for years, really, with people going on PPIs or protein pump inhibitors, where they're stopping supposed stomach acid burning in the esophagus. Well, here's the problem with all of that, is that when you don't have enough hydrochloric acid, you can't stimulate the gallbladder or the pancreas to work properly. You're not going to chelate, bind these things so they can be assimilated and digested properly, so you presuppose and predispose a type 2 diabetic situation.
Yeah. Digestion is one of those, it's a step process. And when it gets messed up at one point, it's messed up throughout the rest of the process. And if the stomach is not functioning the way it's supposed to function, and you're simply not producing stomach acid in the volume you should be producing it in, then it's not going to excite the pancreas, it's not going to excite the gallbladder, you're not going to get proper digestion. The food is just going to get in there, it's going to rot, it's going to inflame the tract even more, you're going to get an elevated immune reaction, an elevated cortisol reaction, and it's the whole cascade of what we see with patients all the time.
Give us a call, 888-630-9625, 888-630-WMAL. If you'd like to talk to us on anything, we're here to answer your questions as best as we possibly can. Put you in a direction that you may not have thought about, something that might actually work for a change. That's why we're here. That's why we do this program. Wednesday evening, the 7th, Dr. Leonard Poe will be your host at the Roselle Center for Healing in Fairfax. We're right off the National Capital Beltway, literally about a third of a mile, and we're in the Red Cross building. We'd love to have you as our guest, and I think that you're going to find this presentation exciting. It's one that can turn your life around. It can handle so many things that you hadn't thought about, so call us, and we're there for you. 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Leonard Poe's presentation on blood sugar handling diabetes. They'll know what you're talking about. Just call them in. Talking about the stress relationships of all of this, Dr. Poe. And let's talk a little bit about the increase in prevalence, if you will, of diabetes. And we're not just talking about it in a type 2 diabetic. Type 2 diabetes was always an adult-onset diabetes, but not anymore.
Right.
It's kids.
Well, that's why we switch it. We no longer. And here's I know we for some reason they can't get off this piece here between it being adult and it being child. I don't know why, but we switched it. It's no longer adult onset. Now we call it type 2 because we see kids getting this a lot of times. Kids are just as stressed, and they're eating worse today than they ever have. We get so much misinformation, I should say, about nutritional values for children and what they should eat and what they shouldn't eat. But kids are largely eating products. You think about when you were a kid. Your diet was completely different than what a kid's is now.
Oh, completely different.
It was your grandmother grew vegetables, and I know all this, of course, because I get to hear this around the dinner table all the time.
Of course you do. You have to listen to the old stories.
Grandmother would grow vegetables, in the garden, and they would eat those things, and she would go down and get whole animals and.
we went to the farm. Yeah, we went to the farm and we got raw milk.
Yeah.
And we made our own cheese.
Yeah.
And we made bread on Saturday mornings, and it was whole grain stuff, and it was so heavy that it'd break the table if you dropped it.
It was made from scratch.
It was.
And kids kids in general aren't getting this anymore. They're getting, everything's got sugar in it. They sugar, corn, wheat, all those things are in just about everything you're going to it's packaged or bottled in the store.
And people wonder why they get sick so quickly. 1 teaspoon of sugar, or the equivalent, decreases the white blood cell capacity to work by 12% for 8 hours. And
it blocks vitamin C receptor sites. It competes with them.
Let's go to the phones. Ann, how can I help you? Thank you for calling. Ann, hello.
Yes, hi.
Hi.
Yeah, I better turn my radio off.
Yeah, turn it off so we can hear each other.
Yes, can you hear me now?
I can hear you perfectly. How can we help you?
Yes, you kind of stress the correlation between blood sugars and stress. Is there any correlation or connection with the blood sugars and panic attacks?
Absolutely. There was a book that was written many years ago called Sugar Blues. And it talked not only the depression that goes along with blood sugar spikes and crashes, but also the anxiety reactions and the panic that goes along with it. Hypoglycemia, low blood sugar, one of the hallmarks is panic anxiety. And you have to look at, the whole picture. Once you start getting patients' blood sugar stable and you start adding the B complex, because it's a B complex relationship in traditional medicine. Now we can go to traditional Chinese medicine and we can talk about that subject from a lot of different points of view. But let's just talk about it nutriently. We talked about the inability of the body to absorb certain things. If we have an inflammatory level, then you can't get proteins in. You can't get blood sugars to transport in the system. So the body gets anxious, it gets stressful, it gets irritable. And if you start balancing the blood sugars out and you find the reason why it's there, remember we're talking structurally, chemically, emotionally, then in many situations the panic attacks go away.
Okay, and of course stress probably, I don't know how to explain it, but perhaps it works on the blood sugar level, so to speak, and it's like an eraser. It erases what blood sugar possibilities you had, and it takes it down to a lower level.
Well, the thing is, with stress and cortisol is going to do a couple different things. In regards to blood sugar, it's going to block your body's ability to use that blood sugar appropriately.
Right.
The other thing is it alters a lot of neurochemistry, and it causes an inflammatory reaction in the brain, which is also going to give you problems with blood sugar, but also with anxiety as well. The other thing to remember about blood sugar is there's an enzyme in the pancreas. There's an enzyme that's found in two places, in the pancreas and in the brain. And in the pancreas, this enzyme is called glutamic acid decarboxylase. They call it GAD.
Wow.
It's found in the pancreas, and it helps with insulin production. But it also helps convert glutamate into GABA in the brain. And GABA is your main neurotransmitter that's for anti-anxiety.
Uh-huh.
So when you're having problems regulating one of them, you're going to have problems regulating the other one as well. And that's why we see a lot of that go hand in hand.
Would in any way any of that contribute to breathing and lack of maybe oxygen that person? I'm not talking about myself, it's the family member.
It's possible only to the extent, and that it stops the transport within tissue of anything. You can have tissue resistance to everything, including oxygen. There's something called citric acid cycle that is part of this whole mechanism that we're talking about. And if the citric acid cycle isn't working, then you can't transport oxygen, and you're going to feel like you have to have more air. Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're in studio, 888-630-WMAL. Want to remind you, this Wednesday evening at 7:30 p.m., Dr. Leonard Poe, my guest in studio, will be your host at the Roselle Center for Healing. Going to be talking about blood sugar handling problems. If you have any suspicion that this is an issue for you, this is an opportunity for you to figure out how to fix it, how to prevent it, what to do to make sure that you don't get to this nasty quicksand. Give my office a call at 703-698-7117. That's 703-698-7117. Want to remind you, go to RoselleCare.com and RoselleRadio.com and re-listen and check it out and see what we have. Let's go to the phones. Susan, how can I help you?
Hi, how are you doing today?
Great, Susan.
I was calling because I have a family history of colon cancer. And my mother has been diagnosed with irritable bowel syndrome. And I have a lot of issues that related to that I deal with, I feel like, chronically on a daily basis. And someone brought to my attention the other day the possibility that I might be gluten intolerant.
Okay.
And that may be the source of my problem. And so I'm just starting to do a little research and look into
Okay, so let's talk about it for a second. We don't have a lot of time, but let me say this to you. The short answer is yes. Gluten, unfortunately, is becoming a pandemic situation, actually epidemic throughout the entire country. And it's a reason for it. You can thank Monsanto and how they've increased the content of gluten in all products. I mean, quantumly. So because it's a protein, your body has a greater tendency to be irritated by it, and we eat too much of it on a day-to-day basis. And even good things you can have a problem with. So the short answer is yes, it's going to affect adrenal function. There's something called serum IgA antibody levels that put out certain type of protective enzymes, and once these things are depleted, then your body becomes much more susceptible. So you can end up with a Crohn's problem, you can end up with a predisposition to different types of carcinomas, but it's I'm giving you less than a thumbnail right now, and we really need to, if you call again or write me on at Roselle Care, I'll try to get back to you, give you more information, but if you call back on the next program, I'll get into it at length. Susan, I appreciate your phone call, but the short answer is yes, and it can be altered. Peter, how can we help you? Peter, are you still there? I guess Peter's not there. Anyway, this Wednesday evening, you're going to be talking about blood sugar handling problems, and tell everybody why they should be there.
Well, because probably most of you actually are having blood sugar problems right now, and you just don't even realize it. That's the thing. Like I said, these things go on and on and on for a long time before you get to that point of, I'm diabetic. And there's ways to prevent this. And also, too, for all those people out there that know, I know my blood sugar's not right. It's always high. Why is it high? I eat right. I eat well. I exercise. I can't figure it out. And, you're beating your head against the wall trying to figure out, how do I get my blood sugar in control? There's a special piece there for all of you as well, because it's this other piece that we call type 1.5 diabetes, and I'm going to talk about that. And that's something that's very different and has to be treated very differently.
This Wednesday evening, Dr. Leonard Poe will be your host and presenter at the Roselle Center for Healing. Call my office, 703-698-7117. We're here every Sunday at 12 noon, bringing you the most up-to-date information on integrative and functional medicine, chiropractic care, acupuncture, nutrition. Call us anytime at our office or send us a note at rosellecare.com. We'll see you next week.